Greetings, second year MSW students. This is Greg, and I'm pretty excited to talk to you about some funding that came through at the last minute that you may be available for. So those of you that attended the information session on workforce stipend programs last January will recall that many of you were asking about the integrated behavioral health program. We had a stipend program for 4 prior years. And our funder told us that they were not going to renew our funding or anyone else's funded program. And so many of you were disappointed that had been discontinued. So this amazing thing happened, which was in April. I received an email that they actually had reversed course, and our funder decided to offer a second round of funding. And I worked with Maxwell Davis, the Director of Behavioral Health at the California Social Work Education Center, which is affiliated with and part of the School of Social Welfare, but organizes all the schools in California and helps support workforce development generally. So we worked together on a Bay Area proposal, and we submitted in June, and we recently discovered that we were awarded funds effective immediately. So there's some great funding available to many of you, and I'm going to talk to you about it now. So I always love to share good news, but I don't always get to. So anyway, telling you a little bit more about the funds. So we have the same funding source as we had previously, and that is a federal government arm called Health Resources and Services Administration, also known as HRSA. And this is their second Behavioral Health Workforce Education and Training Initiative, BWET. We were funded as their first initiative, and we've also, as I said, been funded in their second wave. Essentially, HRSA concerns itself with developing the workforce and expanding behavioral health so that medically underserved areas and populations receive appropriate behavioral health and integrated behavioral health services so as to prevent and reduce health and mental health disparities. In the first funding that we received, it was restricted to students working with children, adolescents, and young adults. This second wave, I'm really pleased that it's opened up across the lifespan. So that means if your population is an adult or older adult population, you are also eligible to apply. Essentially, what this program does is it's going to provide students from our school as well as from several other regional schools to expand the Bay Area's regional capacity for providing behavioral health care services to the communities that are most in need. And, again, with the idea of intercepting and ameliorating health and mental health disparities through integration of mental health and health care, particularly primary care services. And the stipend program involves you, MSW students, getting training, faculty development, as well as developing field placement supervisors to help students be prepared for a future of integrated behavioral health practice. I'll explain more specifics as we go along here. So let's get to the money. So essentially, we have 12 stipends available, and we're going to be selecting 12 of you to receive those stipends. The stipend amount is $10,000, and if you are selected, you will receive funds in your Berkeley account directly in approximately mid-January of 2018. We are expecting funds for the next 4 years, but it's always renewed annually, and so we can never guarantee that. But we are quite confident that we have guaranteed funds for this academic year. So, in other words, 12 of you are going to get $10,000 in January, which is awesome. So, who's eligible? So some of the criteria, or all of the criteria, is driven by our funder, and then of course we sort of think about it as well. So our funder requires you to be a second-year student to be eligible for these funds. So there are 95 of you. You have to be in good academic standing, which the school and the university requires. That means maintaining a 3.0 GPA and also satisfactorily progressing in your second year field placement. The school only allows you to participate in one significant workforce development program at a time. So if you're a Title IV recipient, if you're receiving the Mental Health Services Act stipend, if you're chosen for and select the Latinx Center of Excellence stipend, you will not be eligible for this stipend. For those of you applying for the Latinx Center of Excellence stipend program who are second year students, you may apply for this stipend program as well. But if you're selected for both, you may only opt to accept one of the two offers. So I do highly recommend that you apply for both and double your chances. Probably the biggest part is that this requires you, and this is funding required, that you be in a second year field placement where you're providing some kind of behavioral health service, which can include mental health and health related services that are psychosocial in nature. And the services that you provide either need to be integrated with primary care, so it may be that you're actually in a primary care setting or your host environment is a primary care setting or a federally qualified health center, or you're co-located with a primary care setting, which means that at your site there is a primary care setting that you may not be a part of, but it's part of your actual work site, or you coordinate with primary care. So that means that even if you're not in a primary care setting or you're not co-located with primary care, a part of your social work intern functions is to coordinate and communicate with the client or patient's primary care provider. And so that sort of, all of this is a little open to interpretation, and I'll talk about that at the live information session, which I will tell you about at the end of this webinar. And then, of course, the goal is to serve vulnerable and medically underserved communities. So that's a part of it as well. And most of our field placements are located in those settings. Our funder requires for you to receive this funding, it is a federal source of funding, and it requires that you be able to provide proof of U.S. citizenship or that you're a U.S. national. And so essentially that means that you were born in the United States or one of the U.S. territories, in quotes, Puerto Rico, Guam, U.S. Virgin Islands, American Samoa, Swains Island, et cetera, and so forth. And so we feel pretty conflicted about this being required, but we are going to go ahead and proceed with this program. The idea is that for students that are not able to provide such proof, if we can make other types of scholarship funds available to you that the school controls. So I just want to be transparent and candid that this is a criteria that we're not necessarily comfortable with, but it is part of the criteria to get the funds, and we are going to proceed. So I'm happy to answer your questions or concerns about that. Also, the application is due, and it must be completed by November 16th, midnight, which is a Thursday night. So there's a little bit of a quick turnaround on this. And that's because we were just notified of the funding. So it's always hard to select students for these things. And so I like to be very transparent about how the school goes about that. So obviously there's an application, which, you'll be completing. And then the dean appoints a committee, usually of 3 people, who review each application and score them along the selected criteria. And then there is a discussion among the committee, so people independently review and rank and rate. And then the committee comes together and we discuss all candidates and we decide who are the 12 most qualified candidates based on their application and based on our, frankly, subjective judgment that's guided by the objective criteria. And then we also establish a waiting list. Usually there are 3 to 5 students established on the waiting list, and then other applicants usually are decided that they're not they're not either eligible or they weren't competitive in the pool. So I always chair these selection committees, and I do not vote. So I just ensure that there's a fair process, and that the criteria for the funding source are applied to every applicant. And I just sort of govern the process. If there's a conflict in an unresolved decision, then I do have voting power in those situations. But frankly, I've never needed to vote because usually the committee comes to that independently. So I just facilitate the process. The school has had a precedent of selecting 2 faculty members to be on the selection committee. And usually it's the faculty members that are most familiar with the content area. And so in this case, it'll probably be 2 field faculty members on the committee. And then the 3rd member is usually appointed from the community. And it's usually a practice professional who has deep expertise in the area. And often it's an alumni of our school as well. So these people will receive a copy of each completed application, and they will rate and review it and then discuss, and then we go from there. So I just wanted to be really clear with you about how that happens. And what are we looking for? We're looking for your experience, passion, and commitment to integrated primary care and mental health or behavioral health care. We're looking for students who are motivated to learn about and implement practice models related to integration in behavioral health. It's an emerging trend in our field. A lot of settings are struggling with how to integrate and how to make integration actually work. So we're looking for people kind of motivated to work on the implementation of this, which is kind of confusing and tense sometimes. Since the grant is intended to increase access to medically underserved populations and communities, we are also looking for applicants that have special language capacities or cultural competencies that match underserved communities in the Bay Area. And we're looking at your future commitment to working in integrated settings that are providing behavioral health services integrated with, co-located with, or coordinated with primary care. If you are one of the 12 students that receive the funding, here's what we will expect of you. We will expect that you will continue to progress normally in and complete your 2nd year field placement. We will expect that you will either complete an academic course related to integrated behavioral health. Some of you are already enrolled in the elective course 265H. If you were not enrolled in that course and you're selected for the stipend, you will be expected to complete a training module made available to you in the spring semester. It will not be a course. It will be training that's sort of the key content of the course that will be provided to you as a training module, probably in person and probably outside of standard academic time. So it might be evenings and or weekend commitment. And then we also are going to require all recipients to complete a 1-day training and interprofessional practice at a nursing school in Oakland. And they have a health sciences simulation center, and there's an interdisciplinary training involving nursing, doctors, other allied health professionals. And there'll be, I think it's 5 Saturdays in spring that these 1-day trainings are offered, and you will be expected to attend 1 of those 5 days. Also, there will be a couple of program meetings where you may be required to attend with your faculty member and your field supervisor. Also, at the end of the year, in spring of 2018, we will convene all the regional stipend recipients. As mentioned, there are 3 other schools of social work that are part of this, and there will be an inter-school convening that you'll be asked to participate in. You will also be asked to take pre and post tests related to evaluating the success of this program, and you will be asked to stay in touch with us around your employment for the next 3 years after graduation. Please note that you are not required to work in integrated behavioral health. but we do ask that you search for employment in integrated behavioral health and that you do tell us where you're working. So this stipend program, unlike others, does not have a mandatory work back requirement. Work back is encouraged, but it is not required. So if you have questions, and some of you will, I will be available on Monday, November 6th from 4 to 5 p.m. in Haviland 4, and I will be available to review these slides with you and answer any and all questions about your candidacy to the degree that I can. If you're unable to attend the information session, please don't worry. That will not bias your consideration as an applicant. You can email me your questions if you have any to my email address. And if you don't have questions about this program, just go ahead and begin your application. I'll provide for you the ability to click through the application, and also a copy of what the application involves will be attached to the email that this webinar is attached to. And we do ask that you go ahead and take a look at that. And I think the most important thing is that you answer honestly, and also that you spend some time on the short answer questions so that you can create the most honest but also compelling statement of your qualifications for this program. So please go ahead and do that. November 16th will come up fast. And with all other things being equal, the strength of your essays really do determine who gets stipend funding and who doesn't. So make sure you put your time there. We wish every qualified student good luck and success in the application process. I really appreciate you listening in, and look forward to answering any questions you might have. Thank you so much, and I will go ahead and end this webinar at this time.